All right, this topic might be sensitive to some people, but it's very important to talk about. Alcohol consumption. When not in moderation, it can cause inability to control drinking due to both a physical and emotional dependence on alcohol. And to give us more information on this topic, we have Dr. Janice Coffin with AU and medical students Matthew Ferguson and Michael Brackett. And good morning, everybody.
Good morning.
Good morning.
Thanks for joining us here. Let's get right to the point here. Matthew, what is alcohol use disorder?
So alcohol use disorder is the chronic, uncontrolled consumption of alcohol, which can lead to physical, emotional, and social kind of dependence. It affects currently 29% of Americans. It's most common in those aged 21 to 34 years old, and it's actually more common in males compared to females at about 2.5 to 1 ratio. And your family history as well as other medical conditions can make you more susceptible.
And Matt, how can alcohol affect people?
Sure. So alcohol currently is actually one of the leading causes of preventable death in America, leading up to 140,000 deaths per year.
Wow.
It can also affect our organ systems in many different ways, including our brains, leading to things like stroke, dementia, our hearts causing hypertension, dilated cardiomyopathy, our liver leading to things like cirrhosis and alcoholic liver disease, and much more. The good news is that early recognition and intervention can actually reverse a lot of this damage.
It's a lot to take,
It
right?
is. It is. And Michael, how much alcohol is considered too much alcohol?
Yeah, so how much alcohol really depends on several different factors. First and foremost, there are several different medical conditions that you should avoid alcohol altogether. There are certain groups of people, so if you have a certain medical condition, you should avoid alcohol. Groups such as being under age of 21 or pregnant women should avoid alcohol altogether. The most recent guidelines do recommend less than 2 drinks for women or for men and less than 1 drink a day for men. They defined a standardized drink as a 12-ounce beer, a small glass of wine, or a single shot of hard liquor. And studies do show that the less alcohol overall, the better. So you should avoid drinking too much every day.
Yeah, and when should we be worried about alcohol intake?
So first and foremost, you should have a discussion with your doctor about your alcohol intake, your alcohol experiences, your family history of alcohol. That's a very important first step to take. And then at home, you can ask yourself 4 simple questions. You can remember these questions with a mnemonic CAGE. So for C, have you ever felt the need to cut down on your alcohol intake? For A, have you ever felt annoyed by someone criticizing your alcohol intake? G, have you ever felt guilty about your alcohol intake? And E, have you ever felt the need to have a drink as soon as you wake up, or what's called an eye opener? If you answer yes to any of these questions, that's a really good indicator that you should bring this topic up with your physician and really have a discussion, honest discussion about your intake.
And Dr. Coffin, we've talked about this before on this show, where obviously there was a huge uptick in alcohol consumption during the pandemic. A lot of people were dealing with that. So a lot of people have had to scale back since then. Where can people go to get more information on this?
Yeah, so that's a great question. So for most of you, you may not know this, but May is Mental Health Awareness Month. And so some people, the way that they cope with mental health, if they're depressed or they're irritated, is by drinking. And so kind of knowing, okay, am I drinking too much? COVID kind of led to more people having depression, and so therefore alcohol consumption went up. So there's a couple great websites to go to. The Center for Disease Control obviously is an excellent website to go to, but there's the Centers for Alcohol and Mental Health Services Administration. There's actually a helpline there. You can actually go on that website and it'll actually go through some of the questions that student Dr. Brackett was talking about. You know, are you at risk for increased use of alcohol? And if so, what you can do, where are there more resources? Again, there's a 1-800 number. Again, May is Mental Health Awareness Month, so we're talking about alcohol awareness because this is kind of a stepping stone into that. But if you answered yes to any of those questions, those CAGE questions, again, talk to your primary care physician about, number one, what are interventions that I can do to help decrease my intake? Again, summer is coming up, you know, Memorial Day is coming up. I know, you know, part of life is being able to eat and drink. We just need to do that in moderation. And if we're excessing in that, how can we kind of cut back on that? So lots of resources out there to help you. The CDC, the Substance Abuse Mental Health Services Administration, Administration website. So if you do need help, please reach out. Reach out to your primary care or friends or relatives. There's lots of information out there.
All right, good
Great
points.
information.
And it's never wrong to reach out if you need to. So keep that in mind as well. Dr. Coffin, guys, thanks so much for joining us.
Thanks for
Thank you
having
so
us.
much for having us.
Thank you so much.